perspective, December last year, we have over 200 deaths. We are in the halfway of December. We only have 2 deaths this month so far in our county. So that reduction on the number of deaths is also significant. Now, everyone is concerned about the variant. The vaccine continues to be effective against the variants, protecting against severe disease, hospitalization, and death. And that continues to be the case. Some studies are suggesting the vaccines continue to be effective at higher percentage for the Omicron vaccine. And for us, since we talked to you last, 76% of all new cases that we had were among unvaccinated individuals. Let me rectify that. 76% of the cases were among individuals that have not completed the vaccine cycle, because it could be someone that had only the first dose. So as the mayor mentioned to you, it continues to be a case of a pandemic right now that is thriving among the unvaccinated. And also, the Delta variant continues to be the predominant variant in our county. So it's critical to continue to get vaccinated. As we mentioned to you before we went into the hiatus from the interview, the pressers, we would like for our 5 to 17 student-age children to be a 50% vaccination rate before we got into the break. And we kind of got close. So people who are 5 to 17 today, we are at 42% of vaccinated individuals with at least 1 dose in that group. And that offers a significant protection to the students, although we have a lot of work to do in that area. Another interesting perspective, and it may have to do with this increased vaccination rate in younger individuals, is that the pandemic right now is less in the younger population in school age and is more about 25 years and older, especially 25 to 34 years old, had more than 25% of all new cases. With that, I will respond to any questions that you may have. Thank you.
Okay, as we transition to this phase where we're opening up for questions, if there are any questions in Spanish, we do have Ms. Ilia Torres, who is here, one of my special assistants that can translate into Spanish. We also have our Public Safety Director, Director Danny Banks is here. We have from the Orange County Public Schools, Mr. Scott Howard has joined us, and we also have Dr. Yolanda Martinez from Orange County Health Services, who's primarily been overseeing our services that are being provided at Barnett Park. And then again, Mr. Ed Torres, the Utilities Director, who has kind of been working with the beta testing and the surveillance of our wastewater system. So with that, we'll open it up for any questions at this time. Let me also just say thank you to Phil Brown, the CEO of the airport here, Ms. Carolyn Fennell for facilitating this opportunity today. We chose to be here primarily because I just finished a Greater Orlando Aviation Authority board meeting, and so I wanted to make certain that we were able to talk to our community in a timely manner. So with that, we'll open it up for questions.
Mayor Ryan Gillespie at the Orlando Sentinel. Just wanted to clarify what you said, and maybe you or Dr. Pino could weigh in. How fast is Omicron kind of spreading here in the county? And if the Delta is still kind of the primary driver of hospitalizations, what does that mean with how it's competing and kind of what we can expect moving forward?
It's spreading fairly rapidly. You remember on Monday when we reported to you that when we had done the beta testing reports from the surveillance of our wastewater system, at that point we saw in one of our facilities about 30% prevalence and the other about 10%. But as of the most recent numbers from Monday, correct, Ed, we were at 100% within our 3 different wastewater facilities. So that tells you kind of how quickly human beings are shedding into the system. In terms of the hospitalization, I'll let Dr. Pino talk about that. But keep in mind that so far the indications are that the Omicron variant is not as infectious as the Delta variant has been. And today we confirm with our hospitals, both of the largest hospital systems, both Orlando Health and Advent Health, reported that each of them had 42 cases where individuals were in their hospitals positive with COVID. So that tells me that it is still primarily, I think in their estimation, related to the Delta variant. Okay. All right, Dr. Pino.
Yes, Albina is going to answer that question. I asked her to come because she's more familiar with the surveillance that we are doing in genomics, and so she can explain to you what is happening on that field.
All right, thank you, Dr. Pino and Mr. Mayor. So currently, we have not identified any Omicron variant in Orange County residents, and so it's unclear right now whether or not there is any increased severity for disease and any increase in disease transmission. We currently participate with several academic centers, and also there's the National Strain Surveillance Program that looks for, that does genomic sequencing on patient specimens. Thank you.
Okay, next question.
Troy Campbell with Channel 6. My question is for Dr. Pino. You said with the new variant, about 76% of the cases aren't vaccinated. As I recall, when we spoke about Delta, it's never gone under 90%. Is that possible scientific data then you'll use to look at how the vaccines then are less effective with the new variant versus the Delta variant?
I knew someone will catch on the differences. So what I said was, I was not talking about Omicron. I was talking that 76% of the cases that we have seen since we talked to you last were among people who had not finished the vaccination schedule or had no vaccines at all. And so it was not referring to Omicron or what Omicron is doing, because we haven't detected yet in the county. It doesn't mean that it's not here. It should be here. It's just it hasn't come across the lab yet. So with that, yes, there has been a decrease in that sense of that number who was always above 95%. We don't know the reasons for that. It could be just a data issue that most people have, but we'll see. The reality is that experts are saying, and that's why people need to get vaccinated. Still, Delta should be the concern for us. We should be vigilant about Omicron, learn what it does, how we treat it, and how it's spreading, so that we can better assess that issue. But our fight is with Delta. Delta is what is still here, is still predominant, the variant, and also it was the variant that really hit us hard last 3-4 months, where we have, 700 deaths. So that's our concern. That's what we are focusing. That's what we are seeing in the data. But you bring a very interesting point that I don't have an answer for it right now.
Okay, next question.
This is Melissa Thomas of Florida National News. This question is for Dr. Pino as well. This is another one of those clarification kind of questions. For those that are still dealing with vaccine fatigue or who are kind of confused as to what's going on with Omicron right now, and then we're also receiving news about Pfizer with their various booster shots. Like a lot of the pharmaceutical companies talking about boosters, maybe 3 and 4. Where should people focus on right now? What is the main thing that they need to be doing right now?
So I think that you bring an interesting point. In risk communication, like we are trying to do in this pandemic, one of the things not to do is to give too much information from too many sources. And that's basically what we are all doing, which is the first not to do. So people get confused, rightfully so. Even professionals like us who are accustomed to this type of beverage and language get confused. So people should be focusing on getting vaccinated, getting a series completed, and getting the booster. Now, the vaccines continue to be effective. The data show that the vaccines continue to be effective, and that's what we are today better than we were a year before. It's because we have given almost 3 million doses of vaccines in our county. There is more work to do, and we will continue to do it. Also, something really important for people is to not forget about flu. We have talked about this. We are in the midst of the flu season. The numbers are increasing, and it's important to get vaccinated. You can even get vaccinated the same day for both vaccines. They can be administered at the same time. And another interesting trend that we have detected is that we are doubling our vaccination numbers on Fridays. For the last 4 Fridays, we have the highest vaccinations on Friday. So those vaccinations are mostly second dose or booster. So we think that people are modulating when they get vaccinated, thinking that they may get secondary effects, and then they want the weekend to recover, which is a good strategy. So for those who are thinking to get vaccinated and are concerned about what it could do to you as a secondary side effects, Fridays may be the best choice, so that you have the weekend to be rested and to take care of yourself.
Danielle Lama with Fox 35, Mayor Demings. We are at the airport right now. It's obviously quite busy. Do you have concerns about all these people coming into Orange County for the holidays and potentially more spread of Omicron?
This is something that certainly we are going to have to monitor. Fortunately, we do have the experience now of having lived through this past Thanksgiving holiday period of time, and we saw record-breaking numbers, relatively speaking, coming through the international airport here, and we have now seen the anticipated surge that happened afterwards, and here we are today, and we're still below that 5% threshold, which typically the CDC has said that if you contain the virus within your community, you should be below the 5%. So putting that into context of where we were a year ago when the number was almost twice as high, that gives me some pause to believe that, yes, we're likely going to see an increase due to the travel, the tourist visitations that are going to occur during the holiday period coming up. But hopefully, those who are listening to what we're saying to you, if you are unvaccinated, go get vaccinated. If you haven't completed the series like Dr. Pino has advised you, you should seriously consider that. And if you're not going to get vaccinated, certainly you should be wearing the facial coverings and trying to do what you can do to protect yourself so that you don't get the contagious virus that is existing all over the world today.
Hi, Amanda Castro from Channel 6 is probably best for Dr. Pino. Dr. Pino, how often is the county testing for the Omicron variant? And with the indicator that it's now in the wastewater system, oh, maybe not. And with the indicator that it's now in the wastewater, what does that mean in the coming weeks of Omicron spreading in Orange County?
So this is also in part an answer to Troy's question, which was previously, which is there is routine ongoing gene sequencing for patient specimens. And so that is random sampling, and that occurs at multiple levels. So it occurs at labs that are here, such as our academic centers, also at the state lab and at CDC. And then there's also some targeted sequencing that happens, which is potentially for looking for vaccine breakthroughs to see what what variants might have caused that. And so it's ongoing and it's targeted. So we also do specific sequencing for outbreaks, and also when there's a severe outcome or when there's some epidemiologic interest, such as persons who may have traveled from certain high-risk areas. And so there isn't a standard number of how much is happening here, but it is ongoing and routine and as well as targeted.
Right. Anika Hope from West 2 News. This might be best since it's about schools. I wanted to ask, since we're seeing that the booster appears to be most effective against Omicron, and we know kids can't quite get that yet, most likely. I guess what is the best precautions that you guys are hoping to put in place for that? Would that be any kind of mask mandate for them?
So not specifically for schools, but the same precautions that we would encourage everyone to do, which is if you are not yet vaccinated, do get vaccinated, complete your series, and then when it's time for your booster, get your booster. So the vaccines are part of what the increase is in some of the breakthrough cases is potentially waning immunity, and boosters have been shown to greatly boost the immunity, whether for children or for adults. And so pandemic precautions in school as well for those who have not yet been vaccinated. Wearing of masks, watching distance, and practicing careful hand hygiene. Oh, sorry.
Hospitalización y muerte. Y como hemos dicho, y estaban diciendo recientemente, también continuamos con nuestros esfuerzos para hacer el trabajo en las escuelas. I wanted to add about the schools that also the numbers we have offered in coordination with Health Leader Florida and the Board of Education more than 12,000 doses of COVID-19 vaccines in the school. Not only that, they also recently offered 8,000 doses of flu vaccines in the schools, and that is also to help and augment the efforts that are going down in the community.
Spectrum, oh, is it on? Eric Mock, Spectrum News 13. Probably a question for Dr. Pino, but Mayor, if you want to comment as well, that's fine. So with the wastewater sample showing that, you know, the Omicron variant is spreading here in Central Florida, but yet we haven't seen any confirmed cases yet. What does that say about this variant? Does that maybe mean that it's less severe than the Delta variant was?
No, I don't think that we should read much into we haven't found it yet. Normally what happened in the other cases is about 2 weeks prior to the case is detected in the water. Because a person could have the virus, being shedding virus in the water, but not feeling sick. It takes about 3, 4 days, 5 days to get sick. And then it takes a few hours or days for us to get the sample, get analyzed, and then get into the lab, get the results, and get it on the news. So it's a matter probably next week we will see the first confirmed variant in our county, probably if it goes without a schedule.
Mayor, I have one question coming from Scott Powers with Florida Politics, and it reads, how do Omicron levels in wastewater compare with what you first saw, the Delta, when it appeared in June?
I'll have to look to Ed Torres. The question that is being asked, Ed, is when we see the test results today with Omicron, does it compare with, relatively speaking, to back in June when we saw the Delta really come forward? So I'm going to ask him to come forward and just talk about it in terms of the comparison between the two different periods in time.
Good afternoon. The difference that we have seen between the Delta and the Delta Plus variant compared to the Omicron variant is how quickly it has shown through our wastewater samples. As Mayor Demings mentioned, we started our beta testing last week, and the first samples did not detect any Omicron in the wastewater. Then we saw that being detected in the Thursday sample of last week and again on our Monday sample, becoming now the majority of the variants that we're seeing in our wastewater. With the Delta and Delta Plus, we saw that gradual increase of Delta and Delta Plus, and we saw the Alpha variant decreasing slowly. This has been a much rapid increase, but I want to all of you to keep in mind that this is again a beta test, and they're validating that final assay to complete that testing.
Okay, and it appears that that was the last formal question. The takeaway today, I just want our community to understand that we're in a much better place today than we were, with 78% of those who are 12 years of age and older having received at least one dose. That's in a pretty good place. So I really don't believe that it is necessary for our community to retreat to mandatory wearing of masks. Individuals are going to have to make some decisions themselves about that. Plus, the current state of Florida law doesn't allow local governments to institute such mandates in the first place. But we still have an abundance of opportunities for our residents to get vaccinated if they choose to do so. So as we prepare, during this holiday season, we don't want anyone to get sick because of Omicron, the Delta variant, Delta Plus, or any of the other things that perhaps are lurking out there. So please, we're asking you to make some decisions that are reasonable. If you're around people, crowds where you don't know the people, you might want to consider socially distancing or wearing a facial covering, but we want you to consider getting vaccinated. We want everyone to have a happy holiday season and Merry Christmas during this period of time. So I say that to all of Orange County. That's the purpose of this press briefing today. Thank you all for joining us, and we will see you sometime soon. Thank you.